The International Hip Dysplasia Institute really arose out of the wishes of a mother who had a child with a complete dislocation of the hip that was kind of difficult to treat. And that mom was the wife of Larry the Cable Guy of the Get Her Done Foundation. So Larry the Cable Guy and his wife have funded the International Hip Dysplasia Institute at the Arnold Palmer Hospital to educate and to help do research about hip dysplasia. Well, there's a tremendous amount of work going on in the field of hip dysplasia, not just at the International Hip Dysplasia Institute, but there are lots of centers around the world that are trying to solve the problems that we face. Our role is to help gather that information and to create a database that we can share that information together. So we're in the early stages of that. We haven't accomplished that yet, but that's definitely one of our goals, is to serve as a resource for gathering data, gathering information, and comparing treatment methods to see what works the best. It's the International Hip Dysplasia Institute because we have put together a group of noted experts from around the world who help guide the development of the organization and the research for the organization. And those centers include Mexico City at the Shriners Hospital, the Hospital for Sick Children in Toronto, Canada, a hip dysplasia research program in Southampton, England, a group in Adelaide, Australia, and a group at Harvard, and at the University of California at San Diego. So it really is truly an international effort to find out more about hip dysplasia and also help educate people. The International Hip Dysplasia Institute is at Arnold Palmer Hospital, and with our group, we've kind of looked at things and we've discovered that we haven't done a very good job of teaching parents that swaddling is a risk factor for hip dysplasia. First of all, most physicians weren't all that aware that swaddling was being done a lot. And secondly, we weren't aware that there were some methods that weren't really being done correctly. So our mission has been to put those two together and educate parents that hip dysplasia is a problem and educate them that swaddling is a risk factor and how to do swaddling properly. It's true that parents are not swaddling properly because they haven't been instructed properly. And I don't think that's anyone's fault. It's just, people are swaddling the way that they've been taught to swaddle, and we think that they're not aware that it could be harmful for the hips. The Winnie Palmer Hospital for Women and Babies is actually where our effort is going into the maternal teaching about how to take care of your baby's hips after they're born. So every baby that's born at Winnie Palmer Hospital will get some teaching information about safe swaddling for the hips and a little bit of take-home material, a DVD about swaddling. So we're trying to educate the families about proper swaddling. At the Winnie Palmer Hospital, we also initiated a program where they're using the Halo Sleep Sack and Swaddle. And the Halo Sleep Sack is a blanket. It's a wearable blanket that's worn also to reduce the risk of sudden infant death, because the blankets can sometimes get loose and cover the baby. So every baby that leaves Winnie Palmer Hospital will get a wearable blanket and a swaddle and proper instructions in swaddling. The information about swaddling is somewhat surprising to everyone, really, because no one's, I think, not that no one didn't know it, but we've had experiences where it just hadn't all been put together in one package. And some of the work of the International Hip Dysplasia Institute is to put all the messages together to be sure that the orthopedic surgeons, the pediatricians, the nurses in the nursery, and the parents are all on the same page as far as hip health.